Hello, everyone. I want to welcome you to my presentation. My name is Laquan Pritchard. I am a clinical psychologist at the University of Global Campus. Today, I want to present my research titled Designing Trauma-Informed Intervention for Behavioral Modification, Emotional Control in the Juvenile Detention. The focus of this research is to address the emotional and behavioral challenge that young people within the juvenile detention faces, detention facility faces. The emphasis is on trauma informed care. Our objective primary is the different methods that I will be using in material will be I seek to present interventions like mindful based stress reduction, trauma forced cognitive behavior therapy, positive behavior intervention, supportive intervention support, cognitive behavioral theory. These approaches aspire to help young people control emotional impulses, improve prevailing behavior outcomes, and lower aggression. The research primarily is designed to execute trauma-informed interventions that will assist in improving emotional regulations and facilitate behavior change in detained youth. The project mainly studies the high levels of trauma among young men in detention. It looks at the trauma as a factor which is usually leads to aggression behavior and emotional disregularities. Methods. The quantitative part will entail pre and post individual emotional regulation and aggressive behavior examination. The method will validate instruments like the Emotional Regulation Questionnaire, ERQ, and modify overt aggression scale. The study will also behavioral observation in detention facility to track outburst aggression and adherence to rules before and after effect. On qualitative part, I will conduct a focus group on interviews with young participants, the detention team, the mental health professional. The aim is to clarify how participants see the interventions. This will include knowing how to perceive their emotional experience and behavior change. The research also look at the staff feedback to comprehend the ease of enforcing these traumas-informed approach in the detention. As you take a look at my background on my screen, I give you a little 4 boxes there. They're kind of small. Figure 1, 2, and 3, and 4 talks about the different methods that I use in this mixed method design of research. The intervention will include mindful-based stress reduction, trauma focus, cognitive behavior therapy, positive behavior intervention supports, and cognitive behavior therapy. These will control emotions, lower emotional reactivity, manage trauma, and encourage pro-social behavior. So the results is primarily results will point to positive outcomes. Quantitative data should show the decline in aggressive behavior and increased self-reported emotional controls among young people. More staff members should report fewer violence cases, finding it easy to handle difficult circumstances. Young participants, are also expected to report feeling more supported and better managed in their emotions and impulse. Cognitive data should reveal improvement in the association between youth and the staff, and all-around sense of safety in the detention setting. In general, findings should show the trauma-informed participant produce a supportive environment that is more facilitate to rehabilitation and punitive action. So in conclusion, the research is to anticipate to support the hypothesis that trauma-informed interventions can significantly enhance emotional regulations and lower aggressive behavior in juvenile detention environments. Interventions like mindful-based stress reduction, cognitive behavior therapy, trauma-forced cognitive behavior therapy, and positive behavioral and intervention support are practical mechanisms that can change the juvenile justice environment by concentrating on emotional healing instead of punishment. The finding will advocate a systematic transformation in juvenile detention centers and integrate trauma-informed techniques that support mental health and promote rehabilitation. This will reduce the recidivism and help you integrate into society. Implications. The implications of the study will be far-reaching. The research will give evidence supporting the general incorporation of trauma-informed care of juvenile detention. The finding can influence policies advocating for better staff training, including mental health service and prioritizing rehabilitation rather than punishment. Research will also contribute to the broader body of the work demonstrating that addressing trauma in young people can lessen criminal behavior and improve life outcomes. These findings can inspire similar interventions in other institutional backgrounds, like schools and residential treatment centers. This will imply that the study will further support vulnerable youth population, relevance, and challenges. Presenting this research at a conference will let me share the creative application of trauma-informed care in juvenile detention environments. Feedback from colleagues and specialists will help refine the intervention standards and further the knowledge of how psychological approach can enhance outcomes of young people in the juvenile justice system. One of these issues I face is devising this proposal was combining a diverse trauma-informed intervention into a coherent framework. It is excuse me, it was also complicated to deliver complex research finding in a easily understanding manner. However, regardless of these challenges, I anticipate positive results from this process. Thank you for watching my presentation. I'm eager for the feedback and insights from this conference. This will help refine this trauma-informed intervention and facilitate positive changes in juvenile justice system. Thank you.